This is BBC News with the latest headlines for viewers in the UK and around the world. A message to the British public after the UK's highest death toll so far in the coronavirus pandemic.
And we all share a responsibility to tackle this virus, first and foremost by staying at home.
After weeks of criticism over a shortage of personal protection equipment, the British government insists that there is now enough if used correctly. New York starts to bury some of its dead in mass graves. The state now has more coronavirus cases than any single country outside the United States. And queuing for food in Calais with no social distancing. We report on the migrants still hoping for a better life. Hello and welcome to audiences in the UK and around the world. We're covering all the latest coronavirus developments here in Britain and globally. Firstly, we'd like to take you to these live pictures from the Vatican. These show a stripped down Good Friday service inside the Vatican itself. Normally on Good Friday, Pope Francis would move over to the Colosseum on the other side of Rome, where Romans would pack out to see the Pope, who is also the Bishop of Rome. But because of coronavirus restrictions, the Vatican has stripped back what it plans to do. That is St. Peter's Square there, and there are 8 to 10 parishioners in that procession, and the Pope himself, we'll see in a second. There he is, alone on the stage, on the podium in St. Peter's Square on Good Friday. Now, the United Kingdom has recorded the highest daily increase of deaths due to coronavirus at the end of another week of tragic news for thousands of families. Today has been the third day in a row in which the British government has announced close to 1,000 deaths in a single day. The UK's daily briefing was led today by the Health Secretary Matt Hancock, who confirmed there'd been 980 reported deaths from the virus in the last day, the biggest daily increase so far. That takes the total number of deaths in the UK to 8,958. Globally, there have been nearly 1.6 million cases recorded of coronavirus, and more than 100,000 people are reported to have died. That's according to Johns Hopkins University in the United States. In New York, mass burials are taking place as the death toll there remains high, with more cases of the virus reported in New York State than any other single country. Back in the UK, the Prime Minister Boris Johnson is out of intensive care. Downing Street says he continues to improve in hospital, where it says he has thanked the whole clinical team treating him for the incredible care he's received. Downing Street says his thoughts are with all of those who have been affected by this terrible disease. And European Union finance ministers have agreed an emergency rescue package worth €500 billion for the economies worst hit by the pandemic. Well, our first report tonight comes from our health editor, Hugh Pym.
Work on Birmingham's new temporary hospital has progressed so fast it's ready to take patients today. That was the message from local health leaders at the latest Nightingale Hospital for coronavirus cases based at the National Exhibition Centre. It'll be well equipped, but it comes at a time when some health staff elsewhere are worried about their safety. They say they're still not able to get the right personal protective equipment, and some feel anxious that what they do get is not adequate.
We're getting a lot of messages from doctors on the front line that the current situation is in many parts of the country inadequate. The people are feeling unprotected, that they feel scared when they're at work. They feel unable in some places to use the kit that they're able to bring in from home because other members of the team haven't got it, and that they don't feel confident in what's being provided.
Staff at Newcastle upon Tyne Hospitals Trust say they've had confusing messages. One email this week said due to the current national issues with supply and demand of gowns, an apron instead of gown or long-sleeved apron should be used for aerosol-generating procedures. That means release of airborne particles. A few hours later they were told an apron instead of gown should be used in non-confirmed coronavirus patients. A doctor told us, "I feel betrayed by those who are meant to be our leaders. It's like we're being sent to war without armour to protect ourselves, serving as cannon fodder." In a statement, the Newcastle Hospitals Trust said requirements from Public Health England had changed numerous times over recent weeks, that current advice was fully in line with those, and staff could be assured there were sufficient supplies of protective equipment. Today, the government announced a new plan to get more equipment known as PPE to health and care workers. There will be a lot of scepticism, won't there, still, about another plan being published. I mean, what guarantees can you give that people will be made to feel safe with the right equipment?
What I'd say is that it is a constant effort to get the PPE to the front line, a huge logistical effort. We acknowledge the challenges, of course we do, we face them every day, and we are doing everything in our power to get that PPE to the front line. And those with concerns about PPE at the front line, we're making sure that they have a place that they can go in order to call for help.
Dr Abdul Mabud Chowdhury posted a message to the Prime Minister on social media warning about the lack of protective equipment for NHS workers. That was 5 days before he was admitted to hospital after contracting coronavirus. He died on Wednesday, and his son spoke to the BBC today.
He was a courageous, brave man, and that is something that he's passed on to us. He saw that NHS workers didn't have enough PPE, and he made a call for that. He wrote a letter for that, and well, maybe at the time it didn't get the attention it deserved, but now for sure we are giving it the attention it deserves, and we are not going to stop. We are getting this everywhere. We are making sure we're heard, that my father's voice is heard, and that my father's passing is not in vain.
Scotland's First Minister, meanwhile, repeated the guidelines to the public on social distancing.
The message remains exactly the same as it has been. People need to stay at home. I know how difficult that is, and I know how difficult that will be, particularly over this Easter weekend. Ordinarily, that is a time to see friends and family, it's a time to get out and about or even take a short break. None of that will be possible this year.
Today, some were enjoying the sunshine, keeping their distance and exercising in line with official advice. But there's still a long bank holiday weekend ahead. Hugh Pym, BBC News.
The Liverpool football legend Sir Kenny Dalglish has tested positive for coronavirus. In a statement this evening, the former Liverpool player and manager's family say that the 69-year-old remains asymptomatic. He was routinely tested for the virus whilst in hospital, where he's being treated for an infection which required intravenous antibiotics. Now, temperatures are forecast to hit around 25 degrees in some parts of the UK this weekend, and the government has repeated again the need for people to stay at home, apart from going out for exercise once a day, shopping for basic necessities, and getting medical care and help for vulnerable people. People can also leave their homes to work, but only if they cannot work from home. Fiona Trott has this report from Scarborough.
A picture postcard, and that's because the crowds are missing. What would have been unusual is now the norm.
You wouldn't be able to move down here. Honest to God, you wouldn't. It'd be absolutely heaving. Chock-a-block, beach, pathways, all the shops would be busy, everything.
Our town and every town, certainly on the seaside, we need people to stay at home, keep away, keep themselves safe, to keep us, the NHS, safe, so we can save people's lives.
Other coastal resorts were also deserted, from Southend-on-Sea to Southwold and Skegness, where on a normal Easter weekend it would be impossible to park.
Sir, no running. That's it. Can only walk on the river walk.
In London, officials have been reminding people to keep a distance.
Sir, can you dismount, please? Thank you.
If you're sitting on the bench, you're all right walking around, but staying stationary. Are you from the same household, or...?
In Birmingham, rangers have been patrolling the parks.
Stay indoors because of COVID-19.
So you're saying I'm not allowed on my front garden?
You cannot come on your front garden.
But in Rotherham, one householder thought the police were taking things a little too far. South Yorkshire police have since apologised and described the incident as well-intentioned but ill-informed. Messages like these in Scotland have been seen across the UK's tourist spots, and they appear to have made a difference. There was also a reminder today that people can die 1 month after being infected, so staying apart and staying at home is vital.
Right now, you have to remember there's still a lot of virus circulating, and if we keep ourselves away from other people, the only way you're going to get it is from an infected person. So staying apart from other people is the key to breaking the transmission chain.
It doesn't get more isolated than this, and it's hoped the Easter weekend will look exactly the same. Fiona Trott, BBC News.
Well, let's have a look at what's happening in other parts of the world. France has recorded almost 1,000 deaths in the past 24 hours. It brings the total death toll there to more than 13,000. The authorities say almost a third of those deaths have taken place in nursing homes and other care facilities. In Ireland, the Taoiseach Leo Varadkar has said the current restrictions on movement will remain in place for at least another 3 weeks. But Dr. Varadkar said it was his fervent hope to gradually ease those restrictions afterwards. In Italy, 570 people are confirmed to have died from COVID-19 in the past 24 hours. That's 40 fewer than the day before. The number of confirmed cases has also slowed down from just over 4,200 to just under 4,000. Italy is one of the countries hardest hit by the pandemic, with more than 18,000 confirmed deaths. Pictures have emerged of a mass grave in New York as the death toll there continues to rise. Almost 800 more people have died in New York State alone. Officials say burials are being ramped up at the site on Hart Island off the Bronx. It's long been used for people with no next of kin or families who can't afford a funeral. New York State alone now has more coronavirus cases than any other single country in the world. Here's our North America editor, John Sopel.
It is somehow unimaginable, unbelievable, that in the most famous city of the richest country in the world, they're digging mass graves for those who can't afford a funeral and for those who died of coronavirus with no next of kin. This is Hart Island, just off the Bronx in New York City. Nearly 8,000 people have died in this state alone, and they're struggling to deal with all the burials.
We are in total control of our destiny here. What we do will affect literally life and death for hundreds of people.
On a normal weekend, a tourist venue like the Lincoln Memorial would be packed with visitors. Donald Trump is hoping to reopen the country on May the 1st, but his medical experts are saying be very cautious indeed.
The virus kind of decides whether or not it's going to be appropriate to open or not. So even though we're in a holiday season, now is no time to back off. As I say so often, now is the time to actually put your foot on the accelerator because we're going in the right direction. Let's keep in that direction.
We want this plague to pass over. We want everyone in America to be safe. Psalm 105 says.
The president had originally wanted America to reopen in time for Easter, with churches packed. But in the Oval Office today, this was the reality. No crowded pews, just a blessing from a bishop. And for nearly all other Christians, this unique Easter will be online, virtual and socially distanced. John Sopel, BBC News, Washington.
Well, joining me now is Daniel Drom, a member of the New York City Council. Daniel Drom, the trauma of burying victims in mass graves must be extremely hard to bear.
To see that on the front cover of the two dailies here in New York City was just incredible this morning. To realize that there are so many people who do not have next of kin or family in the biggest city, and probably, I would say, since I'm a city council member, one of the greatest cities in the world. It's just too hard to think about.
How are hospitals coping in your area?
Well, I represent Jackson Heights and Elmhurst in Queens, and we have Elmhurst Hospital. Elmhurst Hospital has 545 beds, all taken. Now they're going to be moving people over to the Billie Jean King Tennis Stadium, which is probably about a mile or so away from the hospital, because we can no longer fit COVID patients into Elmhurst Hospital. So it has been tragic. My community is 68% immigrants, and the immigrant community really does not have many alternatives other than to go to Elmhurst Hospital, especially those who are undocumented. So it is a real tragedy here in my community.
How are neighborhoods coping in general?
Well, it's been difficult. The next issue that I'm dealing with is the food. We're running out of food, and there are many grocery stores who do not have food or are not open. There are long lines in front of the supermarkets. People have to space themselves 6 feet apart from each other. So finding food in this particular area of the borough of Queens has been difficult. We are handing out meals on a daily basis at the public school system, and those public schools, I have 3 of them in my district, are giving out over 1,000 meals a day.
New York went through a different trauma almost 2 decades ago with 9/11. How does this trauma compare?
We've never seen anything like this before. 9/11, we lost about 3,000 people. I think we're up in New York State now to over 8,000 deaths. So that is a huge difference from what happened at 9/11. Of course, we have many more hospitalizations, and this is hitting people in a very personal way. I think that when we get through to the end of this, every New Yorker will know somebody who died from coronavirus.
Daniel Drum, thank you so much for joining us.
Thank you.
Stay with us on BBC News. Still to come. The empty beaches tell a story as Spain records its lowest daily death toll from coronavirus in over 2 weeks. Does it have lessons for other countries?
This funeral became a massive demonstration of black power, the power to influence.
Today is about the promise of a bright future, a day when we hope a line can be drawn under the bloody past.
I think that Picasso's works were beautiful, they were intelligent, and it's a sad loss to everybody who loves art.
This is BBC News, the latest headlines. A message to the public as Britain records its highest daily tally of coronavirus fatalities in hospital, 980. New York starts to bury some of its dead in mass graves. The state now has more coronavirus cases than any other single country outside the United States. Spain will begin handing out masks at metro and train stations on Monday as some companies reopen after a 2-week hibernation period. The news came as Spain recorded its lowest daily death toll from the new coronavirus in 17 days, with 605 fatalities reported over the past 24 hours. A little earlier, I spoke to Carmen Simón Mateo, a virologist and researcher at the Spanish National Research Council. I asked her if she agreed with the Prime Minister that the fire, as he calls it, is starting to come under control.
We pay attention to the numbers, the number of deaths, the number of infected people, and also the number of people recovering from disease. The numbers are in the right direction. So we can say that we are more or less, the fire is already over, but still we have to be very cautious because the numbers are still being to see how they react in the next few weeks. So it seems that we have done the right thing, staying at home, and it looks like the number of infections have stopped, but still there is a long way to do and a lot of efforts to do.
Many people have followed what's happened to Spain in recent weeks and have seen the pictures. What kind of lessons can other countries learn from what Spain has had to endure in recent weeks?
Well, the first lesson is that we know already, not only because in Spain, but in other countries, that asymptomatic people spread the virus. So it's very, very important to detect these people, because before and after having the disease, the virus spread. So it's important to detect all these individuals and put them in quarantine. This is very, very important. Another important thing is to be very careful with elderly people and also with immunodepressed people, for example, because these people we should avoid they get the infection, because we know already that the disease these are the cases with the worst that is the disease.
Carmen Simon Mateo speaking to us from Madrid. Well, here the British Red Cross says that there are thousands of refugees and asylum seekers living in poverty in the UK. And in Calais, across the Channel in France, many migrants remain in makeshift camps, hoping to cross to the UK. The BBC's Fergal Keane reports on how the coronavirus pandemic is affecting those who fled persecution or poverty.
They look like scenes from the world before the coronavirus. But we filmed these crowds nearly 3 weeks into the French government's lockdown. No social distance for the migrants of Calais.
Bonjour, salutes, coffee, warm coffee. Try to wash your hands sometimes.
No hot food either. A sandwich given by the state, the sole meal of the day for hundreds. This camp is on the edge of an industrial estate about a mile from Calais. It might as well be on another planet.
We are sick people.
And how difficult is it for you here?
Too much difficult in here. There is no tent, there is no good food, there is no any drink water, no cloth, no shoe. Too much problem in the jungle.
French volunteers help here every day.
Have some pity, have some... You wouldn't do this to a dog, would you? So you're doing it to human beings who are fleeing the war. I'm ashamed. I can't sleep at night. I'm sick of it. You see, these are people, and they've suffered. They're not criminals. They're the opposite. They've been raped, they've been assaulted, they've been ransomed, they've been tortured.
Everybody here wants to get to Britain. Even under lockdown, it seems a better prospect. I'm on a journey through migrant experiences in Calais and in London. And for people who are already living on the margins, the arrival of the coronavirus has been nothing short of catastrophic. But suppose they do make it here. Migrants will find an asylum system already backlogged and struggling with the impact of the virus. One undocumented migrant from Africa told us she'd survived on odd jobs and help from friends. We voiced her words to protect her identity.
We're desperate. We have no way of paying rent. Can't get anywhere. There are no places offering accommodation. No one giving you money to buy groceries. Food banks are closed.
In Calais now, there are many migrants, a lot of them from Africa, who want to get here. What would you say to them?
I would tell the migrants in Calais not to think it gets easier, not to have that much hope. Just because you're not in the camp doesn't mean that you are going to be treated human, or it's just the same circumstances, different setting.
Even if they can start the asylum process, new arrivals won't get more than about £5.40 a day to buy necessities.
If there's anything in there which you think, oh, I like more of that?
A few food banks still operate. This British Red Cross centre in North London opens twice a week for all who are hungry. Abdul is an asylum seeker from North Africa.
I have a daughter and I have a wife, was working for a restaurant. This I'm struggling, that's why I'm coming here, you know. My family doesn't have food at home, that's the thing.
This centre is a lifeline for those who are surviving with very few resources. And while this is a charity, the workers here do their level best to make it feel about sharing, living up to the larger rhetoric of unity, of compassion in these desperate times. The world is consumed with fear of sickness and economic crisis. Hard times on the margins, getting much harder. Fergal Keane, BBC News.
Let's go back to the Vatican now, where Pope Francis is leading one of the most unusual Good Friday services in the history of the Catholic Church. You can see the Pope there in St. Peter's Square with almost no one around him. Normally on a Good Friday, Pope Francis would cross the Tiber River and sit near the Colosseum, and people would queue up to see him as he takes the normal service, the Good Friday service, as parishioners and faithful mark the way of the cross, the 14 stations of the cross that Christian worshippers mark on Good Friday. Because of the coronavirus, the Pope cannot do that. He is Bishop of Rome, of course, but tonight on Good Friday it is almost as if he is now the Bishop of the Vatican. He cannot leave. He cannot invite people in, so only a few Catholics are allowed to take part in this particular service on this, the most solemn day in the Catholic calendar. In Sunday, the Pope will return to St. Peter's Basilica to mark Easter Sunday services. For Christians, of course, this will be a moment of rebirth for Christianity. But of course, for the world, this Easter, there will not yet be a rebirth, and that Good Friday service continues. Do stay with BBC News.
E parole capaci di fare la differenza.